Assalamu alaikum. We'll continue Chapter 10, Medicinal Drugs, Part 4. At the end of this session, you will be able to define an anti-inflammatory drug, identify the trade name and the generic name of some anti-inflammatory drugs, describe possible side effects and overdose effects of anti-inflammatory drugs, define tranquilizers, describe the possible overdose effects of a tranquilizer, define antidepressant drugs, and describe the possible overdose effects of an antidepressant drug. Before we start, you need to prepare your pencil, papers, and your chemistry book. When your immune system senses stress, infection, or toxic chemicals, it responds by activating proteins meant to protect cells and tissues. This is inflammation. Watch carefully the video to understand the idea of inflammation. There are different signs indicating the presence of inflammation. Here are these signs. We have redness, swelling, pain, and heat. Inflammation is caused by different factors. It may result from blows, foreign bodies, chemicals, electricity, heat and cold, and surgery. To treat inflammation, we use anti-inflammatory drugs, which are substances used to reduce or eliminate inflammation. Anti-inflammatory drugs are of two types. They are classified as steroidal and non-steroidal anti-inflammatory drugs. Steroidal anti-inflammatory drugs are medicines containing cortisone, and you surely have heard about cortisone. These kinds of anti-inflammatory drugs are commonly used to treat asthma, allergies, and arthritis, which affects mainly joints. Non-steroidal anti-inflammatory drugs, represented by NSAID, they are used to relieve pain, reduce inflammation, and bring down a high temperature. They work like steroids. They reduce pain and inflammation that often come with joint and muscle diseases and injuries. They are meant for short-term use. Steroidal anti-inflammatory drugs have many side effects. Can you list some of these side effects? They cause fluid retention, thus a person gains weight, and unwanted hair, moon face appearance, and mental depression. Its overdose is severe. It causes overweight, obesity, hypertension, decrease in size of the muscles, muscular paralysis, and hyperglycemia. Here we have some examples of steroidal anti-inflammatory drugs. We have hydrocortisone or cortisol, which represents the generic name of this medicine. Hydrocortisone R is the corresponding trade name, since it's followed by R. Cortisone is another generic name of another steroidal anti-inflammatory drugs, and cortisone R is the corresponding trade name. Non-steroidal anti-inflammatory drugs have many side effects. I think that you know the most important one. They cause stomach ache or bleeding problems, nausea and vomiting, diarrhea, itching, dermal eruption, asthma attacks, anemia, and acute renal insufficiency. Here are different examples of non-steroidal anti-inflammatory drugs. We have aspirin, ibuprofen, and Advil. The overdose of aspirin causes increase in the respiratory rate. Now that we are done with anti-inflammatory drugs, let's move into a new category of medicinal drugs. But first, watch the following video.
There's no way I'm going to pass this exam. I don't even want to show up.
I was so uncomfortable at that party. It was hard for me to breathe and I got all sweaty. I had to leave.
I won't go to sleep or leave the house unless I've made sure the stove is off and the doors are locked. Sometimes I do this 3 or 4 times.
I have to get to the airport 5 hours early. You just never know what might happen. These are the voices of people who have experienced anxiety. Anxiety is a common reaction to life events, like taking a final exam or speaking in front of a crowd. But when it becomes really uncomfortable and makes day-to-day life hard to live, then it's a problem, or even what we call a disorder.
Anxiety is of 2 types. It could be normal, of shorter duration, and event-related. When you have an exam and you feel anxious, or pathological, that may stem from inheritable tracts, like when feeling anxious if going outside or facing new people. But how can we treat anxiety when it becomes a problem that disturbs our life? Here comes the role of tranquilizers, which are medicines used to sedate without inducing sleeping. They treat anxiety, restlessness, and excitement. Tranquilizers have side effects like any other medicinal drug. They cause restlessness, which is the inability to rest or relax, and irregular sleep patterns. Its overdose causes coma and could lead to death. The most common example of tranquilizers is Valium, diazepam. Note that these medicinal drugs should never be taken without a prescription, and driving should be avoided when taking these medicinal drugs. Other than anxiety, depression is also another problem facing people nowadays. Depression is one of the most underdiagnosed and undertreated of the medical illness. About 10% of the adult population can expect to experience a period of depression serious enough to require medical intervention during lifetime. Depression has many symptoms. They include continuous sadness, loss of interest and pleasure in activities, crying spells, feeling guilt, worthless, and hopelessness. To treat depression, antidepressants are used. Antidepressants have many side effects that we can see in this figure. They have trouble thinking, unusual dreams, dry mouth, muscle weakness, indigestion, constipation, irritability and mood swings, weight gain, problems speaking, dizziness, headaches. Now the overdose effects are unconsciousness, coma, respiratory paralysis, and death. Please, you have to read these pages of your book to study the summary sheet number 4. Thank you for your listening.